I'm Danielle Boris, and I'm so excited you chose to join me for this episode of Unboxing Humans, the podcast where we unlock the human-to-human business model by uncovering what makes each of us a little weird. Unboxing Humans is brought to you by Sandbox. Sandbox's talent intelligence technology uses intrinsic motivation and purpose to identify who is disengaged from work and how to uniquely re-inspire each team member. Learn more at sandboxtogether.com. My guest this week is Andrea Ippolito. Andrea is a health tech nerd, maternal health technology expert, and the founder and CEO of SimpliFed, the maternal health tech platform helping new parents access the baby feeding support they need when they need it. A mom of two under 5 years old, she is a biomedical engineer by training, has worked with the VA, founded a number of health technology companies, has testified before Congress, and is a faculty member at Cornell University. Andrea is an advocate for female entrepreneurship and women in STEM. She is also an expert in maternal leave and workplace efforts around new parents. Andrea, welcome to Unboxing Humans.
Thanks so much for having me. Excited to be here.
You have such an impressive career, all centered in healthcare and bioengineering, I know was your start. I'm curious, what initially drew you to the field?
So I am the daughter of two engineers. So I'm very lucky that I had two positive role models in engineering. And I found that my passion was very much in the biology side of things and the healthcare medicine side of things. I went to this summer program and was super lucky to be exposed to that. And I think that's something we don't talk about enough, is that a lot of where I've ended up at is due to my parents and due to exposure to role models and programs like the one I'm about to share. And specifically the summer before my senior year of high school, I got exposed to medicine, and I was at Shriners Hospital and met a biomedical engineer there. And it was like the lights all went off. If this was like a cartoon, this is when all the bells and whistles would go off, because we're like, oh, I can be an engineer, but in healthcare and medicine. And that's really what got me into this space. And I saw in this lab, it was called the GAIT lab, GAIT. And essentially they hooked up sensors to kids that had different movement issues, disabilities, and you could diagnose what was happening with their gait or how they walked. And I thought, wow, that is so powerful to be able to take engineering to human health.
And so before that, you didn't understand that there was a bioengineering route. Your parents weren't in that space.
Correct. My mom was an electrical engineer. My dad is a mechanical engineer and quality engineer. And I loved biology and I loved human physiology. Again, I had a couple amazing high school biology teachers that got me revved up and excited about it. And so, Marion Wright Edelman has this great quote, like, you can't be what you can't see. And that is 100% true with my career. And I work a lot in women engineering, women in science, women in entrepreneurship. And that is so important. You need to be able to see people in your future, what will be your future career path, because if you don't have that exposure, you don't know it exists.
I was just having this conversation with a friend yesterday, actually, because she is a chemist by training. She got her PhD in chemistry, and she now works with some teachers to go into middle schools and tell the kids what types of careers you can have in chemistry, because she said there's very limited information out there besides honestly being a teacher is often what chemistry looks like to people. And so she said the most rewarding aspect for her was that she was telling this one group of students about how you can restore art using chemistry. And this young girl said, oh my God, you're telling me that I can follow my passion for art and fashion and marry that with chemistry? Because I've been loving chemistry, but I didn't know that I could do both. And she was able to basically keep this middle school girl interested in the sciences because she saw how the fields intersected. And I say all the time, we don't see it enough. Like even the role models, but even just what is out there for us to do. There's so many cool jobs for us to do.
Totally agree. And you see this a lot with women in engineering and science. So I teach part-time at Cornell now in the College of Engineering. and you look at the majors within the College of Engineering that are like truly dominated by women. And I mean that Cornell has gender parity in engineering here, but there's a few majors that like carry the team. Biomedical engineering, 80% women. Chemical engineering is over 50% women. Same thing with environmental engineering. So you have these majors that have like really done a great job of attracting women in engineering. And I think a big part of it is they've done a nice job showing career paths where you can make impact with humans and human health and the environment. Whereas you can be a mechanical engineer and an electrical engineer and make just as huge, if not more of an impact in human health and the environment and climate change. But I don't know if we do a good job of pitching that, frankly. And so I think you see a lot of women go to these fields that have done a better job with their descriptions. And I love that story of the chemist, because there are so many great careers that maybe are more attractive to women, but we don't do a good job of pitching it and communicating it.
That's so interesting to learn about, because I did my undergrad and grad at Cornell as well, and was not in the sciences. So most people in my major were women, but it's interesting that bio specifically, because I think, I mean, this honestly leads us into our discussion. I think that maybe society, we've done such a good job of elevating women's health. Do you think that has something to do with it and people wanting to be part of that?
I think, well, sadly, we've done a good job of elevating women's health because it's so terrible. And for example, we know by looking at the data from the NIH that there is more federal investment in funds in men's-specific diseases compared to women's health-specific diseases. And that's just like a straight fact, and that's very well published on. And we know, sadly, from the data, you know, I am in the maternal health field, maternal and child health field, that, you know, women and babies, but in particular moms, have been left behind in maternal health, and in particular Black women, right? 3 times more likely to die in childbirth. The United States is the most dangerous place, dangerous place to deliver a baby in the developed world. Like, that is terrifying considering how good, frankly, our healthcare is. And by the way, we spend a lot and we spend the most. But for women and maternal health to be left behind, especially for certain populations, it's a disgrace. And so I think what we're now seeing, and especially in light of the Roe v. Wade being overturned, we're now seeing this surge or increased surge in interest of women wanting to dive into this space. And we know that women want to innovate for other women. That's another thing that the data shows. And so if we have more women interested in, say, engineering and science, we know that they're disproportionately going to want to focus on women's issues. And so when I think about how do we get more innovation in women's health, et cetera, it's like, well, let's get more women in this. And actually what we're seeing from the data, it's not a pipeline issue. We have more women ever that are getting undergraduate degrees, more women than men, actually. And so I think we need to further break down. So what's stopping women? And I think a lot of it is in and around what's called the maternal wall. And how do we attract women and retain them to stay in, to innovate and be an entrepreneur, be an engineer, be a scientist, while they start having kids, when frankly society and the infrastructure there has let us down.
And so for those who don't know, what is the maternal wall?
Yeah, so the maternal wall was a term coined by some researchers, but also more popularized by Society of Human Resource Management, SHRM, which is like a big like HR trade group. And essentially what the data shows is that it's not a pipeline problem. More women are getting these degrees, more women are entering the workforce, more women are in the workforce, and some studies show that there's more women and men in the workforce, or just as much. So it's not a pipeline issue. But what the data shows is that when women start having kids is when we start to see a lack of women in leadership, or leadership numbers go down, or retention of women in the workforce go down. And so, you know, I, as an engineer, want to diagnose, okay, so what's happening here? And what's happening here there's a lack of societal infrastructure and support. So what do I mean by that? There's a lack of paid parental leave. There's a lack of childcare support. And let's be real, private sector solutions can help with childcare support, but we need also government intervention as well. I'm in the field of maternal child health surrounding baby feeding support. The Affordable Care Act put in place 10 years ago a policy to help support breastfeeding fully covered by health plans at no cost to you, but most health plans aren't in compliance with that. We had a baby formula shortage last year and it's still ongoing. So the reality is that even though women are, increasing the pipeline or in the workforce, society hasn't evolved in the infrastructure to support retention of women in the workforce. And if you take, it's not a philanthropic reason why we should help support women in the workforce. It's because if we want to have a top economy and the top economy in the world, we need to do a better job of retaining half our workforce so we can innovate, because we know, again, by the data, that women are more innovative when they're in companies and teams.
That unfortunately doesn't surprise me, but it's so disheartening. I'm trying to find the right word. It's so disheartening that companies don't see the value in that. And I know you quote this statistic that only 2% of women plan to leave the workforce to focus on family, but nearly 43% of new moms actually leave their jobs within 3 months of childbirth. Is that due to that maternal wall?
Yeah, I think so. And I mean, this is where we need more research and data to continue to diagnose what are the specific issues, but we do have enough data to show that we need to do more to support women in retaining them. But I mean, it's a huge issue. And we look, in the last few decades, we haven't had this gender parity in the workforce. And the reality is that we haven't evolved fast enough, and we as an economy need to do more, and as a country need to do more to support women in the workforce. There are many actions that Fortune 500 companies are taking. And by the way, there needs to be a whole lot more, right? There is more in fertility benefits. There is a recognition of this maternal wall and having, flexible hours and more support and supporting programs like my organization, SimpliFed, with breastfeeding and baby feeding support that's non-judgmental. But there needs to be more, for sure, both around paid parental leave and universal childcare. But the reality is that Fortune 500 companies, while an incredible engine for our economy, are only one piece of our economy. And so this is where we need government intervention. This is where we need government intervention on paid parental leave, universal childcare support, so we can attract more childcare workers to this arena, pay them a fair wage, but also get some federal and state, perhaps, intervention in here to support childcare. Because one of the reasons we know that women are leaving the workforce is because of this lack of childcare. And so we need more societal infrastructure. We've put in things under this administration. We've put in a lot of physical infrastructure. Now we need the societal infrastructure to complement it. And if you look at the track record of legislation in this country, women's health or societal infrastructure stuff, like paid parental leave, universal childcare stuff, is always the first to go in the docket. It's like moms are always sacrificing, and you see that in our federal legislation as well.
Why is it the first to go, given how important it is for our society and our economy?
Here's my editorial comments. It's because it's still, for whatever reason, same thing with women's health, same thing with the societal infrastructure, it's seen as philanthropy. It's not seen as a critical asset for our nation's economy. And here's the deal, is that we know when we have women in the workforce, we know that more diverse teams via gender diversity perform better. They're more profitable, they're more innovative, they're more productive. And so, we have to start thinking of women's issues as philanthropy, but as critical for our national economy. And I'm not there in these discussions, but I suspect it's because we don't have a seat at the table. We know that the average age of congressional stakeholders is, high in the 60s. We know there's not enough women in Congress. And so again, we know that when women are involved with things, they innovate. So let's bring more women to the table to fight for these, because again, it's not philanthropy. It speaks for itself in terms of return on investment.
Part of what I'm also hearing as you talk in terms of diversity is that it's not just, women entry level, but when we hit this maternal wall, we then get all sorts of other types of diversity in terms of experiences, right? So I'm not a mother, therefore I don't have the same experiences as someone who is a mother, who would then be able to bring those experiences into the workforce.
Exactly. That's so true. It's so important to have diverse perspectives, and those diverse perspectives takes a lot of different firms. And whether that's gender or age or race and ethnicity, there's so many ways where you're from, right? I live in a more rural area now, and that's an important perspective. And veterans and military service members, they bring in such an important perspective. So there's so many different types of diversity that we know allows companies to perform better and more profitably.
Are there other countries that do this really well that we can start to model our workforce off of?
Yeah, the countries that do this really well are the Scandinavian countries. Funny story, I went to a conference in Sweden about 4 years ago, and we landed in the middle of the day on a Tuesday. Like, we got into the hotel lobby at 11 a.m. and I'm checking in the lobby and I'm looking around. It's a Tuesday and I see all these like couples, these partners pushing baby strollers, and I was like, wow, is there like a parade of stroll, like what's going on? Was there like a festival? Is there an event? And it dawned on me, it's like, no, this is because these Scandinavian countries have such good societal infrastructure. By the way, we know they're the happiest countries. That's very well proven.
I was about to say that, the happiest countries. Yeah.
They're the happiest countries. By the way, their economies are doing pretty darn good too. So it's not like they're sacrificing that. But we also know that they have 1 year of paid parental leave. We know that they have tremendous support with childcare. We know that when a woman gives birth, a nurse comes to her home and they do things that you typically see a postpartum doula do. It's similar to my organization, providing ongoing baby feeding and breastfeeding support. They work with them on pelvic floor therapy. I have a friend that I graduated college with, is not a Scandinavian country, but she lives in Berlin. They pay for yoga. I mean, they actually look at mom and they treat her because she's just gone through this major medical procedure, whether you had a vaginal delivery or a C-section, and they actually respect that. And so we know that these Scandinavian countries, Northern European countries actually do a lot to support women, whether that's in the workforce and with these societal infrastructures or with women's health. And we know they're happy and healthier because of it. And that's what the data proves out.
That's so amazing that we have that model, that it's there, we see it, we see how it's working. Why can't we implement it here? And so something that immediately came to mind for me is, in the US, we have such a productivity focused mindset. And unfortunately, I think we see like hours worked as equal to hours productive, almost like an assembly line. And that's just blatantly not true.
So not true. And we know that remote work, as an example, and giving parents, in particular moms, that flexibility to work remotely matters, right? Like, there are appointments in the middle of the day, whether they're for you, say if you're pregnant or postpartum and you're recovering, or for your kids, whether those are orthodontists, dentists, doctor's appointments. We know that kids sadly get sick a lot. And even when you have good childcare, they're out of daycare. And we saw that during the pandemic. This is one of the biggest drivers of women leaving the workforce. Is first, initially, it was the K through 12. We saw women leave the workforce because of, having to do Zoom school. But then halfway through the pandemic, we started to see the under 5 parents, particular moms, leave the workforce. And so companies that actually allow for flexibility with their workforce will better retain them, but also we know you'll get more out of them, because you just need to look at the work model differently outside of the 9-to-5 traditional schedule, which, by the way, was developed like decades and decades ago based on, the factory working system. And so that's just not realistic for how most folks do work these days.
It's also not realistic for how our brains work. Like, when I think of the times that I was most creative or even the places where so much innovation happens, it's college campuses. And that is not a 9 to 5 schedule, right? We have classes, you do research, you do your homework, you go to lab, and you have complete control over your time other than when you have to be in the meeting, which is scheduled. And people are able to give their minds a break or switch to a different task and actually then bring that information in and create this innovation boom.
Mm-hmm. I think so too. And I think there's a way to do it that it doesn't allow people to wander. As someone who's on a college campus a lot, like I do think that there is non-productive time with that, but sometimes, as you said, those non-productive time can lead to creativity. But as I tell students, it's all about the implementation of ideas too. And so I think there is a lot of different ways that you can encourage more constructive, disciplined innovation and still allow for that flexibility.
So let's come back to this maternity leave, maternal wall. You have said that companies with lactation support programs have a retention rate of 94% compared with the national average of just 57%. And this makes me think about the naysayers who say, we can't give a year off paid because then no one actually comes back. So let's talk about what has to happen for companies to support women when they come back.
Yeah, it's an important question. So first off, I think one of the big things we need to improve is that it should be parental leave, not maternity leave. And because until there is true equity in that with both men and women, then women will be left behind. Let's be real, because taking 3 months off, right, is going to set you apart. And what we know from various studies, and I think this was published in the Harvard Business Review, is that a lot of the things that keep women back is actually unintentional discrimination. So let me give you an example of what I mean. People actually think they're being accommodating and nice by not offering a work trip to a woman because she's, 4 months postpartum, et cetera, or, 5 months pregnant. And they actually think they're trying to protect them and not feel like they're forcing them into that. And we know that keeps women back, right? Because we know that travel and leads to networking or perhaps presentations at a conference. There's 1,000 different reasons why those types of work opportunities help people to get that job. And the thing is, maybe the woman chooses not to travel and that's what's best for her, but you have to give her that ability to make the best decision for her. And so things that companies can do are, first off, support things like flexibility in the workforce and help design a plan that works for them. And secondly, similar to what you were saying, they can provide support programs and actually talk about things out loud. So what do I mean by that? So providing breastfeeding and baby feeding support programs, which, by the way, are required under federal law health plans to cover. So companies shouldn't be having to pay out of pocket or buy up these solutions. They can work with, selfishly, organizations like SimpliFed that have existing contracts with commercial and Medicaid health plans that provide breastfeeding and baby feeding support to their employees. They shouldn't have to buy it up per se. And so we work with parents starting during pregnancy to educate them on their baby feeding options, do a lot of listening to understand what their goals are for baby feeding, whether that's formula feeding, breastfeeding, combo feeding, pumping. We're very inclusive of the feeding options. And after baby's born, we know that 85% of women start off breastfeeding. And so let's support them in helping them reach their goals in that arena if that's their goal. And we know that providing support in and around the transition back to work is critical too, whether you're working inside the home or outside the home. And being able to get support to help navigate, say, bottle feeding, pumping, selecting a pump, making sure you're getting sized for that pump, because we know that if you're not sized properly for that pump, this is a device, this is a medical device, then it can cause pain on your nipples. And let's be real, breasts are organs and they need to be treated like that. And so we know that this is so critical. And so providing support around the transition to work, which we know is a key moment for retaining women in the workforce, but also working with them in an ongoing way as their baby feeding goals evolve. And so baby feeding and sleep, we know, are the two biggest issues facing women, barring any health issues. And so how might companies better support them with baby feeding and sleep? And the good news is it's covered by health plans at no cost to them. So they shouldn't have to pay for this. And so it's technically a free resource that employers should be leveraging.
Do you feel that there's a big education gap? I mean, I never even knew that this was a free resource that companies should be leveraging. And while I'm not a mother, I'm a business owner. So theoretically, that should be very clear information.
I think you're so right on. There's two major issues right now. One is people don't realize that breastfeeding support is a mandated benefit required by federal law under the Affordable Care Act. And it's a 10-year-old policy. It's not like, oh, it was stood up last year and it's still getting implemented. No, it was developed 10 years ago. And the issue is that HHS hasn't enforced this policy. But here's the good news. The White House announced last September that HHS will be beginning to enforce this policy. So hooray on that. But I do think not a lot of folks know, both families, employers, et cetera, that this is a required benefit under health plans. So you need to advocate for yourself if your health plan isn't covering these services. Secondly, I think a lot of people don't realize that there is a clinical specialty. There are health professionals like lactation consultants that will inclusively, whether you're breastfeeding, formula feeding, support you. And I think folks are exposed to, say, the lactation consultant in a hospital setting, but there is actual support after you leave the hospital, but also before you give birth. So lactation consultants will work with you during pregnancy, do a lot of listening to understand what your baby feeding goals are. And then after baby's born, work with you in an ongoing way. It's a bit like mental health care therapy and physical therapy. You don't just have one appointment and you're good. Having access to ongoing support really matters.
That's so interesting. I'm glad that it's getting enforced because that's what we need. I'm curious if there's also an aspect, and I've read about this, where as soon as a woman announces to her employer that she's pregnant, she sort of gets shuffled into HR. Like, oh, don't talk about it. All communication goes through HR. And then when she comes back, that's all through HR. And there's a disconnect from the team, which I think has a lot of consequences. Is that part of it as well?
I think so too. There is this nervousness. I know when I was pregnant with my first daughter, I was hired and I went into my manager's office and told her I was pregnant. I was so nervous because I was like, oh, this is like, I'm a new employee and I'm pregnant. And she was incredibly supportive. I mean, she was a mom herself. It shouldn't take that. But let's be real about this. So let's talk about this because, Fortune 500 companies, have the ability to have more funds in the coffers, say, than a small business owner. So this is really hard. This is a hard situation because if you have a small business and you have a team of 5 and someone's out for 3 months, that's a lot, right? It's a lot for the team to take on. Now it's necessary, as we've talked about, for retaining them. And we know this retaining women is critical for productivity. We know it's critical we know diverse teams do better and they're more profitable. So the data is there to support it, but it still, quote unquote, leaves burden on the remaining team members. And this goes to large companies too, but especially small companies. So this is where we need federal intervention of funds that can help offset and at least bring on someone maybe temporarily so that there's not that burden on the team, because unless there's both men and women taking it together, as we've talked about, and unless there is financial support for companies, especially small companies, I think we focus way too much on Fortune 500 companies, but the majority of folks don't work at Fortune 500 companies in this nation. So how do we actually provide support for workplaces so that this isn't seen as a burden, but it's about, we need to protect and retain women so that we can continue to be successful.
It's really interesting that you say that, because I think that's the other concern of people who don't fully understand parental leave is, well, what happens to that work? Someone has to take it on and now I'm paying double. And how do I do that? And I think it does also all start with even awareness, right? Did you know that there are funds available, or that there will be funds available, and you don't have to pay it yourself, right? The government is here to help this process.
Well, I wish that sadly, there are no funds yet.
Yes, but in the future, right? That's what we need. And if everyone could get on board with that, we can start to affect policy changes. And I know that you did testify in front of Congress. Was this part of what you testified about?
Well, I testified in Congress in January 2020, before everything got shut down. And specifically, I testified about diversity in patents and diversity in commercialization. And this was a part of what I testified about, because when you look at the data of patenting as an example. And what's cool about patenting is that there is a ton of data, because it's like very crystal clear. You put in the patent, it gets approved. Like it's actually a very data rich source. And we know that women are patenting at a much, much, much lower rate than men. And we know that patenting rates for women versus men pre-kids are actually not so bad. Still not proportional, but like not bad. But we know is when they take a dip is when women start having kids. And the thing that's sad about it is that patenting rates actually go up when someone becomes a dad, and who knows why. That just might be by the time they're at that inflection in the career. But that's a big part of the advocacy that I and our team likes to do, because by the time a woman gets enough experience, confidence, expertise, it happens to coincide with in the time when you're typically having kids. So we've been investing in women, their education, K through 12, college, grad school. And it's just shocking to me that right when they're actually getting super productive, they have all this expertise, they have this confidence, that we're not investing in them. It's just so frustrating to see this. And we see this with the patenting data. And so we talked about this, and you can see my testimony online because it's public, but we need to do more to help support women in this commercialization journey. And it all comes back to these societal infrastructure things we talk about. The data is so clear.
So as a wrap up, because I could talk to you about this for truly hours, what should companies do today? And maybe even what do you do as a business owner today that can help solve this maternal wall and parental leave?
Yeah, well, thanks so much for asking the question. So on our website, simplifed.com, in the resources section, and also in the employer section, we have like a whole set of resources that employees, and one of the things we advocate for is leveraging breastfeeding and baby feeding support services like SimpliFed, which start working with families during pregnancy and continue working with them postpartum virtually. We have a national network of providers. And again, this is fully covered by health plans. Things like that, making sure that you have parental leave policies in place, making sure that you have flexible work environments to retain women, whether that's remote work or job sharing. There's so many things that you can do, but also acknowledging the fact that it is a different, as we say, like chapter or season in a parent, both men and women. Again, we need to have that parity for men and women with the parental leave, but this is a different season. And so it's not that they're going to be less productive per se. It's just that the way they work is going to look different. I think we need to recognize that. But to your question, or what does my company do? I love to be very transparent about this. It is hard. We are a small business. I am pregnant with my third daughter, and I'm the CEO of the company. And we have, only a finite amount of funding. So what do organizations like ours do? And this is something that's always a work in progress. And I think it's very important to be vocal of how we think about this, but also that it's not so cut and dry, especially for small businesses and things that don't look like the traditional Fortune 500. And I always cringe a little bit when people talk about examples of case studies of what Fortune 500 companies do, like Bill and Melinda Gates Foundation. They essentially, when a woman goes out, or a man, hopefully it goes out on maternity leave, they backfill with someone as a learning opportunity, I think for up to a year, although I could be wrong there. But again, they have the funds to do that. He's one of the richest people in the world. And so I think we need government intervention here to help offset these funds, because Bill and Melinda Gates Foundation is not representative of a typical organization in the US workforce.
And ultimately what I'm hearing is make sure that people feel a sense of belonging, and that people still feel included, and that they're still being given those opportunities. That one of the worst things we can do is sort of, all of this seems to bubble up, is say your life is harder if you're going to keep working here now that you have a child. That's almost what everything you're saying comes down to, is that's what companies are doing now.
Yeah, it's harder and it's wonderful. And we know that moms in particular are the most efficient. We can multitask like no other. And so let's support women in the workforce now that they have all this great expert, men and women in the workforce, now that they have all this expertise once they get to a certain age, and we'll be more productive and effective as an economy.
Yeah, absolutely. Whatever companies can do for everyone, right? To make work fit more seamlessly into our lives. And I guess the other thing that is really coming up for me right now is this idea of motivation, because I talk a lot about intrinsic motivation. And I feel like in our workforce, actually, I don't feel like, I know that in our workforce, we're set up to be extrinsically motivated. And there's a sense that if you don't have to be sitting there doing the work, you won't do the work. But if we understood what intrinsically motivated people and we could align their work, then people would actually be excited to work. And then maybe we could start to adopt more flexible policies because we could start to build that trust. We know that someone is going to do their work, even though they're not working 9 to 5. That's a big fallacy, right? That just because someone is working 9 to 5 means they're doing great work between 9 and 5. So how can we really set up work that motivates people and that includes people? They all start to work together, and helping women, helping men, it all helps everyone in the workforce as well. Sort of diversity initiatives help everyone flourish at work, and then the company flourish.
100%. Could not agree with that more.
Awesome. Well, thank you so much, Andrea. Everything will be linked in the show notes, but Andrea is the founder and CEO of SimpliFed, along with many other accolades. And thank you for joining me today on Unboxing Humans.
Thanks so much for having me.
Thanks for listening to this episode of Unboxing Humans. Don't forget to subscribe and please rate us 5 stars. This rating allows other amazing humans to find our podcast and listen to our guests' wonderful insights. Thanks so much and have a great rest of your day.